A very good evening to all of you. One thing I want to tell you is that the Supreme Court has ordered that NEET PG will be conducted in one shift only. So this is the latest news. So it is a good news for us because it will be conducted in one shift and it will be more beneficial for all of you. So today we are going to do surgery. In why surgery is important? Surgery is important because surgery has 30 to 35 questions in NEET PG. So if you master this subject, you will definitely get a very good branch because your score will be very high and rank obviously will be a single digit or double digit rank. So let us move to the first question. See, regarding NEET PG, you have to master each and every subject, at least the high value subjects also. So surgery is one of the surgery, obs, gynae, medicine. These subjects, they have long questions. Definitely, questions will be long, and you have to. It will take you will take some time to read the question carefully. But regular practice of MCQs will take you to the next level. Please click the link in the description to join the 3-day Ultimate NEET PG Revision Boot Camp. It will be very beneficial for you, and please share the link to your friends also so that a lot number of people, you just go to the description and click the link there. And if you are first time to this channel, I want to tell you that I regularly come live with MCQs, and if you have any difficulty with any of the topics, tell me in the comment box. I will prepare a video and upload it so that it will be beneficial for all of you. Again, I wish you all the best. Please share this video with your near and dear friends so that they are also benefited. Remember one thing, that you are not competing with your friends or other people. You are competing with yourself so that what you are today, you become a better in that tomorrow. So sharing this video will help others also. And let us begin with the first MCQ. Most common cause of small intestinal obstruction is A. Intussusception, B. Idiopathic adhesion, C. Tumors, D. Postoperative adhesions. Now, the most common cause of SBO, that is small bowel obstruction, is post-surgical or post-operative adhesions. The most common cause of intestinal obstruction in adults are intestinal adhesions. What are intestinal adhesions? They are bands of fibrous tissue in the abdominal cavity that can form after abdominal or pelvic surgery. In children, the most common cause of intestinal obstruction is telescoping of the intestine, that is intussusception. If the question had been children, then you will write intussusception. But it is generalized, so we can write it as post-operative adhesions. So the correct option here is D, post-operative adhesions. Cox specular tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst, D. Cylindrome. Now this Cox specular tumor is a sebaceous cyst linked growth that can resemble a squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from simple tricholemmal cyst in the hair follicle epithelium. So the correct answer here is C, ulcerated sebaceous cyst. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is the treatment of choice. D. 5-year survival rate after treatment is 60%. See what happens. The correct answer here is total gastrectomy with adjuvant chemotherapy is treatment of choice. It is a correct answer. So it is C. Please click the link in the description to join the 3-day Neet PG Breakthrough Blueprint Revision Blueprint event, or you can call it as a boot camp. Which one of the following preservative is used while packing gat-cut suture? A. Isopropyl alcohol. B. Colloidal iodine. C. Glutaraldehyde. D. Hydrogen peroxide. It is isopropyl alcohol. 10% isopropyl alcohol is a routine packing fluid used in packing catgut sutures. Catgut is available in glass tubes containing isopropyl alcohol and small quantity of water. Catgut is prepared from the intestine of sheep. Primary hyperparathyroidism pheochromocytoma may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid. C. Papillary carcinoma of thyroid. C. Anaplastic carcinoma of thyroid. D. Follicular carcinoma of thyroid. It is medullary carcinoma of thyroid. It is characterized clinically by medullary thyroid cancer, pheochromocytoma, hyperparathyroidism. Approximately 70 to 95% of individuals with men 2 year develop medullary thyroid cancer, and 50% develop pheochromocytoma, and 15 to 30% develop hyperparathyroidism. Meconium mileus is associated with A. Cystic fibrosis, B. Infant or diabetic mother, C. Hypothyroidism, D. None. It is cystic fibrosis. Which of the following nerve is commonly damaged during back burning sensation? A. Subcostal nerve, B. 10th thoracic nerve, C. 11th thoracic nerve, D. Iliohypogastric nerve. It is iliohypogastric. The nerve commonly damaged during back burning sensation is iliohypogastric nerve. Damage to this nerve results in development of right inguinal hernia. Mag burning incision or grid iron incision is commonly done for appendectomy. In this, an oblique incision is made in the right iliac fossa about 5 cm above and medial to anterosuperior spine at the right angle to spinal umbilical line. Dysphagia lassoria is due to A. Esophageal diverticulum, B. Aneurysm of aorta, C. Esophageal web compression by aberrant blood vessel. It is compression by aberrant blood vessel. Surgery for undescended testis is recommended at what age? A. 6 months, B. 12 months, C. 24 months, D. 36 months. It is 6 months. Dacron vascular graft is A. Textile biologic, textile synthetic, non-textile biologic, non-textile synthetic. It is textile synthetic. What is the most common position of appendix? Pelvic, paracolic, rectocecal, rectoperitoneal. It is rectocecal. Double bubble sign is seen in. It is seen in A. Duodenal atresia, duodenal stenosis, volvulus. In fact, it is seen in all. So correct answer here is D. All. Curling ulcer is seen in A. Burn patient, B. Patient with head injury, C. Jollinger-Elser syndrome, analgesic drug use. It is seen in burns patient. All are true about amoebic liver abscess. More common in female, more common in left lobe of liver. Metronidazole is mainstay of treatment. D, E, and it is except, so it is A and B. It is in fact more common in females and it is more common in right lobe of liver. Indication of liver transplantation are all. A. Biliary atresia, B. Sclerosing cholangitis, C. Hepatitis A, D. Cirrhosis, except hepatitis A. In hepatitis A, you don't do liver transplantation. Care sign is seen in splenic rupture is A. Pain over left shoulder, pain over right scapula, periumbilical pain, pain over renal angle. It is pain over left shoulder. Breast conservation surgery not indicated in A. Large glandular breast, B. SLE, C. Diffuse microcalcification, D. All. It is all. Mondos disease is A. Thrombophlebitis of superficial veins of breast, carcinoma of breast, premalignant condition of breast, filariasis. It is thrombophlebitis of superficial veins of breast. Mondos disease is thrombophlebitis of superficial veins of anterior chest wall and breast, Although it has also been seen in the arm, frequently involved veins are lateral thoracic vein, thoracoepigastric vein, and superficial epigastric vein. Lateral aberrant thyroid refers to a congenital thyroid abnormality, metastatic focus on lymph nodes, tumor over a lingual thyroid. It is metastatic focus on lymph. Most common site of CA esophagus is A middle one third, B upper one third, C lower one third, D lower end of esophagus. It is middle one third. Corkscrew esophagus is seen in which one of the following condition? A carcinoma esophagus, B scleroderma, C achalasia cardiac, diffuse esophageal spasm. It is diffuse esophageal spasm. Corkscrew esophagus, also called pseudodiverticulosis. It is also called curling esophagus. Diffuse esophageal spasm is a motor disorder of esophagus characterized by repetitive, simultaneous, non-peristaltic contraction. Symptoms are substernal chest pain and/or dysphagia, diagnosed by manometry, also called nutcracker esophagus. The most common type of tracheoesophageal fistula is C. Esophageal atresia with distal tracheoesophageal fistula. The best investigative modality for gallbladder stone is oral cholecystogram, percutaneous transhepatic cholangiography, C. Ultrasound, D. Intravenous cholangiography. It is ultrasound. Strawberry gallbladder is seen in gangrene of gallbladder, porcelain gallbladder, adenomatosis, cholestasis, or cholestasis. VIPoma is associated with syndrome: A. Jollinger-Elson syndrome, Werner-Morrison syndrome, carcinoid syndrome, Cushing syndrome. It is Werner-Morrison syndrome. All are resected in Whipple's operation: duodenum, head of pancreas, neck of pancreas, common bile duct, except neck of pancreas. Tendency of colonic carcinoma to metastasize is best assessed by A. Size of tumor, B. Carcinoma embryogenic antigen level, depth of penetration of ball ball, proportion of ball circumference, depth of penetration of ball. Commonest cause of interception is submucous lipoma, mycos diverticulum, hypertrophy of submucous pairs, polyps. It is C.